committed to making life better for the communities we are privileged to serve. In fact, better is our mission, improving lives through personalized health and care. What matters most to our patients matters most to us, offering a comprehensive range of inpatient, outpatient, and emergency care services so you can get the quality care you need right here at home. San Juan Regional Medical Center, celebrating life better here since 1910. KSJE is supported by the Farmington Museum. What if you could jump into the world of wild kratts and swing through the trees like a monkey, or hunt like a dragonfish? Now you can. Wild Kratts, Creature Power, and Ocean Adventure Museum Exhibit, opening September 24th through January 7th at the Farmington Museum. Tickets at farmingtonmuseum.org. 10 minutes past 8 o'clock. It is Tuesday morning, the fourth day of October. I'm making it go too fast. 2022. Good morning, everyone. I'm Scott Michlin, and thank you for tuning in to KSJE 90.9 FM, over the air, of course, here in San Juan County. In Durango, Colorado, of course, we broadcast at 103.3 FM. And everywhere else on the planet, you can always listen to us wherever you might find yourself at KSJE.com. Just stream from our website, or if you're near a smart speaker, just ask it to play KSJE, and guess what? It does. Great to have you here, everyone, and great to have our video viewers with us this morning. This is a visual radio station, so good morning to our viewers who are watching the video program on KSJE's Facebook page, our YouTube channel, and our Twitter account. We're glad to have you here with us, everybody, this morning, and welcome aboard. Coming up today, it is our monthly commitment to CHIC, the Community Health Improvement Council of San Juan County. We'll be getting an update on all the things CHIC is doing, a big project they are working on to get together for the next month, I think, as a matter of fact, maybe in November. So we'll learn more about that coming up in the next few moments right here on KSJE. And then later on this hour, we'll be checking in with Amber Francisco out at the Farmington Regional Animal Shelter. She will be introducing us to Pearl, the cat you see on the screen right there. Pearl and some other animals available for adoption this week. So you'll meet all of them coming up later on this hour at 8:50 a.m. on KSJE. Then it's time for Roving with the Arts, our classical music program. Mick Hess will be here. He is playing selections from Claudio Monteverde this morning. Also the Fiore Musicale. You'll hear those pieces coming up today on Roving with the Arts at 9:06. And don't forget, you can connect with us on our Instagram page in addition to Facebook, YouTube, and Twitter. And if you're a podcast person, you can subscribe for free to KSJE Podcasts, wherever you listen to podcasts, so check those out. Outside our studios here at San Juan College, here's the picture of the college just a few moments ago as folks were arriving for classes today. A cloudy morning so far. It's 49 degrees outside our studios here at San Juan College, so it is a cloudy and cool fall-like morning at the moment, and it's going to be a fall-like day today. The forecast calls for partly sunny skies. 70 degrees for a high today is all, and take a look overnight tonight. Partly cloudy with a low of 48 degrees this evening. Sunshine tomorrow with a high again near 70, maybe a chance of showers Wednesday night, and then again partly sunny skies on Thursday at 69 for a high, 71 on Friday, and then maybe some showers again on Saturday, Sunday, and Monday, but temperatures staying right around 70 degrees. Well, let me turn to my guest who is here with me this morning, as I mentioned, representing CHIC, the Community Health Improvement Council of San Juan County. Amanda Evans is back with us this morning here in the studio. Good morning. Good to see you.
Good morning. Thanks for having me.
You bet. Thank you for coming in and representing CHIC, as I mentioned. And so I know CHIC has been a great partner with KSJE and coming in every month to talk a little bit about some of the members of CHIC and the things that CHIC does. And so let's start there, I think, by just reminding all of us the reason behind CHIC. This is an organization that is actually in place in other parts of New Mexico as well, in addition to San Juan County's CHIC.
Yes. Now, not all of them are called the fun name like CHIC.
Okay. Well, we have the funnest name.
Yes. We do. And but yes, other counties throughout the state have them. Almost every county does. They have what they call in some form a health council. And it's really supposed to be the planning health body for kind of the hub of the community around health for that area.
Got it. And so the idea is to bring groups together to kind of talk about what's going on and what services each provides and things along that line. And I think the membership of C.H.I.C is pretty open-ended, is it not?
Well, the membership is open to anyone in the community. You don't have to be an organization, although we do have a lot of service organizations, social services, nonprofits, a lot of the people who are really geared around health in the community. But we also have just some community members who really care about making a difference and want to sit in on the meetings and have input into it.
Right. And when you start thinking about it, the term health can include a lot of different things, which is what it means for C.H.I.C as well, this Community Health Improvement Council, because health could mean education, health can mean transportation, mental health, all these different things, correct?
Yes, and that's something, when we say health, a lot of people think, oh, am I going to the doctor? Am I getting my annual dentist visits? But health is so much more than that. A healthy community means, we have transportation to get to those places. We have services for veterans. We have senior issues that, might need addressing. There's all these facets to health that aren't just medical and dental. It's, do we have access to healthy foods? Do we have access to walking trails and things like that to make us healthier? And so there's like very different levels of health and different ways that things we might not normally think of impact health.
Right, right. So it seems to me that the governmental agencies in the county are kind of thinking about that more and more as well as they invest into the community. I think about the walking trails, the trails along the river, things along that line. We're seeing a lot more street projects with maybe bike trails built in and bike paths built in and things along that line. Is that kind of the idea too?
Yes, I think people are really learning that the more we do prevention stuff, so the more we get healthier, the less we have to address it in some of these other ways through the medical. I mean, we'll always have medical. You need to do your checkups, your visits and things, but we don't want to have so much waiting till we have a huge population with diabetes. We want those walking trails. We want the access to healthy foods to address it before it gets to those issues.
Right. More proactive than reactive medical care. Yes. Got it. And I think we're seeing some of that too. And I think the population wants to be more active, at least it seems to me. And Farmington and San Juan County have kind of embraced this, outdoor idea of outdoor activities and things along that line, and for tourism and economic development and things along that line. So all of those things, I think, are part of this conversation.
Well, we have a great county for that. We have a lot of, places to go out, do the trails. And like you said, the cities are doing great with adding places. We have, I don't know Patience always knows the count on the parks and stuff, but we have so many parks here that other cities don't have that many. And so we have great places to take our kids and to do some of those activities. And so, those are just little pieces of all of what it makes up to be a healthy community.
Right. Very true. And so that's kind of what C.H.I.C is doing, is to try to look at all these moving parts, and there's a lot of them, right? To talk about, how we're doing, what do we need to do better? Maybe are we duplicating some things? Do we not need to be doing that? All these different types of things to try to just keep moving forward.
Yes, because we can get into kind of our silos as organizations to where we're just doing our own programs and we don't know what anybody else in the community is doing. And so the C.H.I.C is really a place where we can meet monthly and talk about that. So, someone can come and say, hey, I have this idea, whatever that is, what's already being done around it. And so then you get this feedback from, 40 different groups or people or organizations that say, oh, this person's working on that, or this person's working on that, or no, there's nothing that's being done and we do need it. And so it's a place where you can make those connections and where we're not spending money on something we're already doing over here that we just don't know about.
Right. And that brings me to what you're planning or hoping to plan for next month, right? To try to get a lot of folks together and folks even from outside of the purview of C.H.I.C to come together and find out what's being done and who is here in the county these days?
Yes, what we've talked to people and realized is we haven't had a lot of in-person events over the last 2 years for obvious reasons, and we're just starting to get back into those. And what we have found is that a lot of us, I've been with C.H.I.C for 14 years now, and pre-COVID, I had a lot of connections in the community, knew a lot of the organizations. Well, people have changed jobs, people have left the area, people have retired. Just those connections aren't the same as they used to be. And seeing someone over Zoom is great, but sometimes we need that in-person talk, one-on-one connection. And so what we want to do is host like a networking event. We haven't come up with a great name yet, but basically, like National Night Out tonight, a lot of the social service organizations will have booths there. Partnership will be there. And that's kind of, we tend to do our networking around trying to help the people that are there coming to our booth to talk to us. But it's very, like hit and miss of, it's really busy, so I'm going to be at my booth to talk to people, and then we try to exchange cards. And we want this to be an event where people can just come and focus on, I provide these services and meeting connections. Like, I know my clients are going to need these referrals. What organizations do that? Making those name connections to where if you call an organization, you know who to ask for, and you're not just cold calling them.
Right. I'm going to throw this out here, Amanda. Take it for what it's worth, okay?
Okay.
CHIN, Community Health Improvement Network. Just file that away. Okay. There you go. I'm just going to say, you heard it here first, everyone, if they pick up on it. But that's great. Well, you're hoping to do this maybe in November. Is that kind of the idea, end of the year?
That's what we're hoping. We know it gets really busy from Thanksgiving on to the end of the year. So we'd like to try to plan something for the beginning of November. So right now I'm really in the planning stages. I'd love some advice if somebody's been to something like this, because I have several ideas. We want to know, do people want to have booths, set up their information? Do they just want to bring cards and talk to each other? Do presentations? Like, there's all these ideas. And so I would love for some people to, if you've done something like this, it was amazing, it worked really well, let me know.
Right.
And so I'd love, or looking for sponsors, if there's a business out there that wants to help buy some lunch for our people that are going to be coming to this. We are not funded for that. So we would love to be able to provide some snacks or things like that. So it's really in the planning stages. I'm hoping we'll be able to get it planned for early November before the holidays hit and things get crazy. But so that's just, we don't have a date or anything yet.
Gotcha. But you're thinking about maybe full day, half a day? Hard to say at the moment.
It really
right?
depends on what people want, and so that's why I think we'll do. I think we're going to be sending out a short survey with at least the people who work with C.H.I.C, because we have all their email addresses, just asking, what would they want? Could they commit to half a day? Could they commit to a whole day? Because we'd also like to spend some time talking to them about what are their issues they're seeing now that COVID is changing. Where we're not facing the same issues we were a year ago. What are some of their clients, things that are coming up for them, and how we as a health council could maybe help address some of that.
Right.
So we want to kind of, be able to have some conversations along with the networking piece.
Sure. It seems like we've gotten to a place with COVID that we're learning to live with it and I guess manage it better maybe than what we're learning more about it and able to maybe make decisions about, do we want to go to this event, or do we want to go and wear a mask at this event, or do we want to stay home, or whatever the case may be. But it seems like we've learned, and the healthcare industry, I think, has learned to kind of maybe manage it a little better than before, because we have maybe effective vaccines and other treatments as well.
Right, and we've got those steps that we can take now, where it really was like kind of it was an emergency panic type situation where we had to address it really quick, and we didn't have all the facts. And now that we know more, we know, we have information on how to get a booster if you don't have it. We have information on testing, all of that. And so we have those pieces to where we can plan safe events. We know some people are going to feel comfortable wearing a mask and some aren't, and that's okay. And we're going to have, some ways to do things safely. And make people feel comfortable.
And there may still be some lingering health effects as well, certainly mental health and things like that, socialization. I know, talking to the superintendents, they're concerned about some of the younger kids who may be, second graders, but they've never been to school before this year or last year, half a year, or whatever the case may be. And so they don't have maybe a lot of those socialization skills that normally they would have coming just being around other kids.
Yep, I have a first grader this year, so I know those. It's a different. They have not seen the same world as most first graders did a few years ago, and so, we're definitely in different places, and that's why I think this networking and connections with other organizations is so important. We know the schools are doing programs with their youth, but what else is out there that they might be able to tap into? What is going on? That they could refer someone if they really are having an issue, and so we just want to make those connections that we haven't been able to make over the last couple of years.
Right. So So stay tuned, everyone, I guess, is what we say in the radio business, right? But if anyone wants to reach out to you with some ideas or sponsorship opportunities or what have you, what's the best way to reach you?
So my direct number at the partnership is 505-566-5877. And they can leave a message, or I have an email, which is evansa@sjcpartnership.org.
Okay. There you go. And that's for Amanda Evans to help out with this upcoming networking opportunity, maybe known as Chin. We don't know. We'll see if she picks up on it. I'm just saying. You're very diplomatic and very polite. But it's kept planning, hopefully, for maybe sometime in early November. So it's only about a month away, Amanda. You realize that, right?
I know, and that's why we may not be able to make it work
Okay.
with the holidays. We're coming up fast on that. So if
Sure.
not, we'll still be.
But you still want to do something.
Yes, and we still need that planning component.
That's
Some good
true.
ideas, sponsors. So it may be that it gets pushed into January just to give, because there's so much that goes on around here. We have some great holiday events, and I don't want to take away from any of those. So we're just going to see what happens. We're going to try to have a planning meeting next week, hopefully, and see what ideas we get and what dates we can come up with, and go from there. But I will definitely be back to let everyone know exact dates and everything.
Sounds great. And I know the one thing that either people love or hate about the holidays in our area is that most of the big things happen the same week.
Pretty much,
And
yes.
so once you're done with that, if you survive that week, you're good.
True. We
You
can try
know?
to plug it in before or after that week. So,
Right.
yeah.
There's a lot going on that week after Thanksgiving is what I'm talking about, everybody. But anyway, there are other events certainly throughout the holiday season. And so, but a lot of big ones are that week. So that's for sure. I wanted to ask you a bit more about C.H.I.C, and I know this is, again, kind of devised by the state, right? The state decided that they would like to have some of these improvement councils in different parts, in different communities, right?
Well, what happened is long before I came on board, we had what they called maternal child health, and it was just specifically focused on moms and babies and families. And then a few years before I came on, so it would have been early 2000s, they decided they wanted to really expand. They decided, we need more in our communities than just mother and child issues. We definitely have those, but we want to really focus on a broader health picture for each community. And part of that is because a lot of states have local health departments in every county and every city, and we don't. San Juan County is really lucky because we do have an office here, but not every county does. Some of our smaller ones really don't have that local health office that people can go to. And so they started creating these health councils from the maternal child health and kind of transitioning them over. Some places still have both, some incorporated it together into one. And so that's where it really came from. And now, and we partner really closely with Department of Health to do some of the work we do. We have some funding through them this year to make our job a little easier, to be able to hire people. I do this part-time through the partnership and work on some other grants through the partnership to be able to keep doing this. And so we definitely have a connection statewide.
Sure. But in San Juan County, it's really been the partnership that's been a partner with the state to make CHIC a thing, to make it viable and growing and, working for some of the things that we're talking about.
Yes. And, each county decides their own. We have some counties that have their health council is a 501c3 by itself, so it's a standalone entity. Some are under their county office. And so we, as a council, chose before I came on board, to use the partnership as the fiscal agent for the health council. So that's, some confusion has happened over the years of, what exactly role does the partnership play? And it really is the place where it can hold the money from DOH and kind of facilitate having a coordinator, doing some of the work and making sure we meet our requirements with DOH.
Right. Well, and having these regular meetings, I guess, right, hosting some of those or organizing those and bringing these folks together, and with this event that you're talking about, coming up with that as well.
Yes, and they've been a great partner with the Health Council. They've been so supportive, and just in housing the Health Council and being able to put resources behind it that, if we were by ourselves as just an entity, we wouldn't have had. There's been some years where we didn't have funding through Department of Health, and it was really the partnership donating time to keep the coordination of this group going.
Right. which is great and
Yes.
and worth of a shout out. So thank
Yes.
you for doing that, because again, the work is really important. And again, it's not it doesn't cost a lot of money necessarily to get people together once a month, but still the fact that you can get together, and even during the pandemic, you were still meeting by Zoom, I think, right, for most of the time.
Yeah, we're actually still holding our monthly meetings via Zoom because
Okay.
what we figured out is a lot of these organizations are so busy that it's easier for them to show up to via Zoom, and so we'll probably, at least for the near future, continue monthly via Zoom, and then if this networking event either in November or January takes off, we might start doing those once or twice a year as an in-person kind of meeting.
Right. Got you. But really important to keep that going, I think, even during the pandemic was my point as well, to say, that you were able to still keep meeting and learning how people were dealing with stuff during that whole 2-year period.
Yeah, and it was very valuable because we were able to have monthly presentations by some of these groups. So again, I think I mentioned, programs changed, people changed. And so it was, somebody might get a lot of funding for one program because of everything that was going on, and they could get on the meeting and share, like, we have this available, please refer your people to this. Here's who qualifies. This is how we can reach them. This is how we're changing our services. A lot of people had to go to that online Zoom stuff. And so people were like, well, are they still doing anything? And so we were able to tell people, yes, these organizations are still working, and get that word out. And I think that was really important to what was going on in the community.
Right. With the latest meeting of C.H.I.C, what are some of the topics that are coming up? Is it a lot of post-pandemic types of things, or just the usual fall types of things, back to school and other stuff? Do you have anything that comes to mind?
All of that.
All of it? All of the above?
All of the above. But
Okay.
no, one of the conversations we've really been having, we've actually created a health equity committee, because that's something that really came up over COVID, was some of the disparities. Even, whether someone has running water or not is huge on whether then they could wash their hands or whether they needed hand sanitizer. All these, there's a lot of issues just based on even where you live in the county or what your resources were, if you had transportation, and those disparities and those really contributed to whether everyone had access to the healthcare they needed over the last couple of years. So those are some big pieces that are coming up now that may not be currently affecting people, or maybe they are, but how do we address them so it doesn't happen in the future? And how do we make it more equitable for people to have access so that everyone's not going to choose to be healthy. We all have choices, but we want everybody to have the access to where they can be healthy if they want to be.
Right. And I think that was a big eye-opener for folks, to learn that there are people living in the community that don't have access to running water, or maybe don't have access to transportation to get to a doctor, or to get a shot if they so want a shot, or a vaccine, or what have you. And that, I think, was a big wake-up call for folks.
Yeah, and that's one thing we had some funding to help with promote the vaccines, and it wasn't that we wanted to promote necessarily everyone needs to get one, but we wanted to make sure that people had access. One of the things we even heard was, we've had quite a few doctors retire, so we have people who are looking for new, just general physicians, and getting into one might take a little while, and that's who you want to talk to make sure, is the vaccine a good option for me? What do I need to do for it? And so we want people to have access to those doctors so they can make informed choices, so that it's not just they're getting, their information from wherever, but they're getting
Right.
accurate, correct for them information.
Right. And that's what I think the refrain, at least here at KSJE, was throughout the pandemic, was if you have a concern about the safety or effectiveness of the vaccine, talk to your healthcare provider. But you're saying maybe folks didn't have a healthcare provider, and so that was some of the issues that are coming up.
Yeah, and that, I'm not saying that was everybody's issue by
Sure.
any means, but there are different ones. Again,
Right.
the transportation, we had a lot of really great people who came together, Office of Emergency Management, DOH, we're having these clinics, but did people know about them? Did people have transportation to them? And I think our community really came together to try to address some of those, but how do we do that long term? How do we make sure the next time something happens like this, or even just on a day-to-day basis, that people have what they need to be healthy?
Right. Well, and as you say, right, it's not difficult for me to get in my car and go see my doctor and get a checkup and whatever the case may be. But for someone who doesn't have access to transportation or a doctor or what have you, even if you're not in a pandemic, it's still a problem. It's still an unequal situation.
Right. And we were just, I met with Be Well, a representative from Be Well, New Mexico, a couple weeks ago, and they were talking about, we're going to have a lot of people coming off of Medicaid soon because the state has had an emergency to where they kept everybody on who even weren't still qualifying. And so when we have this huge, they're talking thousands upon thousands of people that may come off at one time. If they don't qualify for another insurance plan or they can't afford it, that's a big group of people that then are not going to have coverage. And so how do we as a community address that and make sure that people are still getting what they need? And how do we connect them? Because Be Well New Mexico has great resources. They have plans that people can afford. But how do we make sure they know about each other?
Right.
So that's part of what this networking is connecting. How do we reach the people in the community that we might be missing?
Right. And that's really important. And again, the whole idea is that there should be affordable health care in this community, in this country. And so I think there is, but like you, I think a lot of folks sometimes don't always know where to find that information and how to get signed up. And there's usually a process, and it's a government thing, and it's a process.
Yeah.
And you need documents and forms, and
yes.
Not everyone is thrilled about having to do that, even for healthcare. I get that.
No, it can be hard, and especially, with things changing, if you've lost your job and you've had health insurance through that job for years and years and years, and you have the paperwork was just filled out by your company and you don't even know where to start, what does that look like? So we want to make sure people have that information, or if they don't know where they know in the community where they can go and get that. And what's been great is we've had things like the resource center come up that the county's done, and so the mental health resource center, and so people can go there to get referrals and get help and things like that. And we just want to make sure our job is not to create those things necessarily as a health council, but to get that information and make those connections.
Right. And to make sure people know where to go.
Yes.
And what's available. And,
yes.
And that's important as well. And I think the Mental Health Resource Center is a great example of kind of an idea that was talked about and maybe looked at and said, we seem to have something missing in our community, and what can we do? And then the county stepped in to say, what can we do to maybe fill that need and provide those referrals for these at-risk folks and help them in some way. And that's what we have.
Yeah,
today.
And that really came about because they did a needs assessment and looked at all these issues. And so that's where the Health Council can come in on a different level or a different topic maybe, because we know the hospital does a needs assessment, the county's done this behavioral health one. So we don't want to duplicate any of those, but where are the pieces that are outside of those that we want to bring together and maybe plan around?
Right. Very good. Well, Amanda, we are just about out of time today for our segment, but thank you for coming in. Well, if folks would still like to reach out to you about this event coming up, maybe in November, but just to help you plan it and offer some help or sponsorship, phone number and email address again?
505-566-5877 and Evans, EVANSA at sjcpartnership.org.
Okay. Very good. Amanda, thanks for coming in this morning. Always appreciate it. Amanda Evans here talking with me about CHIC, the Community Health Improvement Council. Maybe you'll hear more about CHIN. I don't know. Just stay tuned. We'll see. Right here with me on KSJE. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello, this is C.H.I.C from the Student Achievement Center. This week, we're bringing you coaching tips of the week for week 7. Taking good notes. Studying starts in the classroom. Pay attention and take good notes. So when you're studying later, you're just reviewing information. Speak with your professor about recording lectures on your phone. A recording can complement your notes so you can go back and re-listen to the information in case there are other details you pick up on later to note. Effective note-taking strategies can have a direct impact on your study habits and is one of the most important study tips for college.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College. KSJE is supported by the Aztec Artist Studio Tour, Saturday, October 8th from 10 to 5 and Sunday, October 9th from 11 to 4. 20 artists will be featured at 6 studios located throughout the city of Aztec. Paintings, sculpture, pottery, jewelry, drawings, and fabric are all featured, plus all sizes and price points. Find out more online at Aztec Artist Studio Tour on Facebook, or follow the signs Saturday and Sunday, October 8th and 9th. KSJE is supported by Aztec Motocross. Located on Highway 173, Aztec Motocross offers a safe and competitive racing environment for the growing off-road and outdoor industry. Upcoming racing weekends, September 24th and 25th, and October 22nd and 23rd. Also, the New Mexico State Championship Motocross Race Series, October 8th and 9th. Find out more online at aztecmotocross.com or 505-393-5222.
How the semiconductor chip shortage paved the way